If you are over 60 and you have noticed that your legs feel heavier by the end of the day, that your feet get cold even in a warm room, or that a walk which used to feel effortless now leaves you needing to stop and rest, I want you to stay with me for the next few minutes, because what I am about to share is not a trend and it is not a gimmick. It is one of the most well-studied fruits in the world for vascular health in people exactly your age, and I am going to walk you through the actual research, not just the headline. My name is Dr. Ava Carter, and I have spent my career studying how the body changes as we move through our 60s, 70s, and beyond, particularly when it comes to blood flow. Circulation problems in the legs are one of the most common complaints I hear from patients in this age group and one of the most under-addressed. People are told to walk more, wear compression socks, and wait to see if it gets worse. What they are rarely told is that there is a specific, well-researched fruit that has been shown in clinical trials involving people in their 60s and 70s to support the exact systems that break down when circulation starts to fail. That fruit is the pomegranate, and today I am going to explain exactly why it matters, what the science actually shows, what it does not yet show, and how to use it in a way that gives you the best chance of feeling a real difference. Before I go further, I want to ask you something. In the comments below, tell me how old you are and whether you deal with leg heaviness, cold feet, cramping, or that restless, achy feeling by the end of the day. I read the comments on this channel, and knowing what you are actually dealing with helps me choose which research to bring you next. Let's start with what is actually happening inside your legs as you age, because understanding the problem is the only way to understand why a food like pomegranate can help. The inside of every blood vessel in your body is lined with a single layer of cells called the endothelium. This layer is not just a passive tube. It is an active tissue that controls how wide or narrow your vessels become, how easily blood moves through them, and how well oxygen and nutrients reach your muscles, including the muscles in your calves, thighs, and feet. As we age, the endothelium gradually loses some of its ability to do this job well. Researchers call this endothelial dysfunction, and it is considered one of the central drivers of vascular aging. When the endothelium is not functioning optimally, blood vessels become stiffer and less responsive, and that is a major reason why circulation to the legs and feet declines with age, why people experience that heavy, achy, cold feeling, and why walking distances that used to feel easy start to feel like work. This is precisely the area where pomegranate has been studied most seriously, and unlike a lot of the fruit found on so-called superfood countdown lists, pomegranate has real, peer-reviewed, human clinical trial data specifically in people over 55, not just in petri dishes or in young athletes. Here is where I want to slow down, because I want to walk you through actual studies, not vague claims. In a randomized, double-blind, placebo-controlled clinical trial published in the journal Geriatrics in 2025, researchers recruited 86 community-dwelling older adults between the ages of 55 and 70. Participants were randomly assigned to receive either a standardized pomegranate extract or a placebo every day for 12 weeks. Neither the participants nor the researchers knew who was receiving which one until the study was complete, which is exactly the kind of rigorous design you want to see before trusting a result. The researchers measured physical function using real, objective tests: gait speed, how fast someone could stand up from a chair, and grip strength, all of which are established markers doctors use to track functional aging and, importantly, are closely tied to vascular health in the limbs. They also tracked cognitive function using computerized testing. That same research group from Manchester Metropolitan University and collaborating institutions in the UK published a related trial in the journal Nutrients, specifically looking at pomegranate extract's effect on inflammatory markers and cardiometabolic risk factors in adults aged 55 to 70. This matters because chronic low-grade inflammation is one of the mechanisms believed to damage the endothelium over time and accelerate the stiffening of blood vessels that leads to poor leg circulation. Their findings built on a broader meta-analysis of 16 separate randomized clinical trials, which found that pomegranate consumption reduced markers of inflammation in the body. The same research team also found that pomegranate extract had measurable effects on blood pressure regulation, which is directly relevant because elevated blood pressure and poor peripheral circulation are closely linked. In a separate randomized, placebo-controlled trial published in the journal Nutrients, researchers tested a combination of citrus and pomegranate polyphenols in 36 healthy older adults aged 60 to 75. This was a crossover trial, meaning every participant eventually received both the treatment and the placebo at different points, which is a particularly strong way to reduce the chance that individual differences between people skew the results. After 4 weeks of supplementation, the researchers found a statistically significant improvement in hand grip strength compared to placebo. They also measured blood markers tied to oxidative stress and endothelial function, including nitrate levels, which reflect how much nitric oxide is available in the bloodstream. Nitric oxide is the molecule responsible for allowing blood vessels to relax and widen, which is essential for blood to move efficiently down into the legs and feet. Now, I want to be honest with you about why nitric oxide keeps coming up, because this is the actual mechanism, not marketing language. When your blood vessels need to deliver more blood to a working muscle, the endothelium releases nitric oxide, which signals the smooth muscle in the vessel wall to relax. That relaxation is what allows the vessel to widen and let more blood through. As we age, and especially in people dealing with circulation issues, this process becomes less efficient. The polyphenol compounds concentrated in pomegranate, particularly a class of compounds called punicolagens, along with the elagitannins they are built from, appear to support this nitric oxide pathway and to reduce the oxidative stress that damages it. There is another layer to this story that I find genuinely fascinating, and it involves what happens to pomegranate compounds after you eat them. Punicolagens and other elagitannins in pomegranate are not very well absorbed by the body on their own. Instead, bacteria living in your gut convert them into a different compound called urolithin A. This conversion is actually why pomegranate's effects can vary somewhat from person to person, because not everyone's gut bacteria produce urolithin A at the same rate. In people who do produce it efficiently, urolithin A has become one of the most actively studied compounds in aging research over the past several years. It activates a cellular cleanup process called mitophagy, in which the body identifies and clears out damaged mitochondria, the structures inside your cells responsible for producing energy, and allows healthier mitochondria to take their place. A study published in Frontiers in Nutrition found that urolithin A's ability to improve vascular endothelial function specifically depended on the composition of a person's gut microbiota, which helps explain why some people respond to pomegranate more noticeably than others. A separate 12-week clinical study using purified urolithin A supplementation found improvements in vascular endothelial function alongside increased diversity of beneficial gut bacteria, and in older adults specifically, a randomized controlled trial found that 12 weeks of pomegranate extract significantly increased levels of a hormone called IGF-1, which researchers noted could play a positive role in vascular aging, although they were careful to note that more research is needed to confirm the long-term significance of that finding. I want to pause here and give you the honest caveats, because I think you deserve that more than you deserve hype. Most of these trials are relatively short, typically 8 to 12 weeks, and most involve generally healthy older adults rather than people specifically diagnosed with peripheral artery disease or severe venous insufficiency. That means the research supports pomegranate as something that meaningfully supports the vascular and inflammatory pathways tied to leg circulation in people over 55. But it is not a replacement for medical treatment if you have a diagnosed circulatory condition, and no reputable researcher would tell you otherwise. If you have been diagnosed with peripheral artery disease, deep vein thrombosis, or any other vascular condition, or if you are on blood thinners or blood pressure medication, you should talk to your doctor before making significant changes to your diet, in part because pomegranate can interact with certain medications, including some statins and blood pressure drugs, by affecting how your liver processes them. With that said, let's talk about how to actually use pomegranate if you want to give your body the best chance of experiencing these benefits. The studies that showed measurable results generally used one of two approaches: standardized pomegranate extract in capsule form, dosed around 700 to 1,000 milligrams daily, or regular consumption of pomegranate juice or the fresh seeds known as arils. If you prefer the whole food approach, aim for around half a cup of fresh pomegranate arils daily, or 6 to 8 ounces of 100% pomegranate juice with no added sugar. Read the label carefully, because many pomegranate juice blends on grocery store shelves are diluted with apple or grape juice and contain far less of the actual polyphenol content that these studies were built around. Consistency appears to matter more than any single large dose. The clinical trials that found benefits used daily intake sustained over 8 to 12 weeks, not occasional use. If you are going to try this, think of it the way you would think of a daily walk or a daily medication, something you do steadily over weeks and months, not something you do once and expect immediate results from. Because the conversion of pomegranate's compounds into the active urolithin A depends on your gut bacteria, supporting your gut health more broadly may actually improve how much benefit you get from pomegranate. This means a diet that includes fiber-rich vegetables, whole grains, and fermented foods like yogurt or kefir may work synergistically with pomegranate consumption, since a healthier gut microbiome appears more likely to produce urolithin A efficiently. I also want to mention something practical that patients ask me constantly, which is timing. There isn't strong clinical evidence that any particular time of day meaningfully changes pomegranate's effectiveness, so the honest answer is to build it into whatever part of your day you will actually stick with. Some people prefer it with breakfast, some prefer it as an afternoon snack. The research supports daily consistency, not a specific hour of the clock. Let me address a few of the most common questions I get whenever I talk about this research, because I suspect some of you are wondering the same things right now. The first question is almost always, how is pomegranate different from other antioxidant-rich fruits like blueberries or dark grapes, which also get talked about for circulation? The honest answer is that many fruits contain polyphenol compounds that support vascular health in some way, and the research on berries and dark grapes for cardiovascular markers is genuinely real as well. What sets pomegranate apart in the specific context of aging and leg circulation is the depth of research conducted specifically in adults over 55, using standardized extracts with objective functional outcomes like gait speed and grip strength rather than only blood markers. That combination, a well-defined study population matching the audience I am talking to right now, plus outcomes that translate to something you would actually notice in daily life, is relatively rare in nutrition research, and it is why I chose to build an entire video around this one fruit rather than folding it into a generic list. The second question I get is whether pomegranate juice is just as effective as the extract used in these trials, since juice is easier for most people to find and use consistently. This is where I want to be careful, because it is a fair question without a perfectly clean answer. The standardized extracts used in clinical research are manufactured specifically to contain a known, consistent, concentrated amount of punicalagins and related compounds, batch after batch. Juice varies. A high-quality 100% pomegranate juice with no added sugar and no dilution will still contain meaningful amounts of these compounds, but the exact dose will vary from bottle to bottle and brand to brand in a way that a standardized extract does not. If you want the closest match to what was actually tested in these trials, a reputable standardized extract is the more reliable choice. If you prefer whole food, pure juice, or fresh arils are a reasonable, evidence-informed choice, just understand you are working with a less precisely dosed version of the same compounds. The third question is about side effects and safety, and this is important enough that I want to spend real time on it rather than rushing past it. Pomegranate is generally very well tolerated in the clinical trials I have described, with mild digestive upset being the most commonly reported issue in a small subset of participants. However, pomegranate can inhibit certain liver enzymes, specifically the cytochrome P450 enzyme system, which plays a role in how your body metabolizes a range of medications. This is not a rare, theoretical concern. It has been documented with certain statins used for cholesterol, some blood pressure medications, and certain blood thinners. If you are taking any prescription medication, especially for your heart, blood pressure, or blood clotting, please talk to your doctor or pharmacist before adding concentrated pomegranate extract or large amounts of pomegranate juice to your routine. This is not me being overly cautious for the sake of it. It is a genuine, documented interaction, and I would rather you ask the question and get a clear answer than skip that step. I also want to address something that I think gets lost in a lot of health content aimed at older adults, which is the difference between statistically significant and life-changing. When a clinical trial reports that a treatment produced a statistically significant improvement in gait speed or grip strength compared to placebo, that is a real, measurable, scientifically meaningful finding. It means the researchers can be reasonably confident the effect did not happen by chance. But statistical significance and the size of an effect are two different things, and in nutrition research, effect sizes are often modest rather than dramatic. I say this not to talk you out of trying pomegranate, but because I think you deserve an accurate expectation. This is not going to reverse decades of vascular aging in a matter of weeks. What the evidence supports is a real, meaningful, incremental improvement in the biological processes tied to circulation, of the kind that, layered together with other healthy habits over months and years, genuinely adds up to a difference in how your legs feel and how well you move. Something else worth understanding is why gut health keeps coming up in this conversation, because I mentioned earlier that not everyone converts pomegranate's compounds into urolithin A at the same rate, and I want to explain why that matters practically. Researchers have found that people generally fall into different categories based on how efficiently their gut bacteria perform this conversion, sometimes described loosely as high producers, low producers, and non-producers of urolithin A. This is part of why pomegranate research sometimes shows variable individual results even within the same clinical trial. It is not that the science is wrong. It is that human gut microbiomes are not identical, and the compound doing much of the heavy lifting for vascular benefit depends on bacterial conversion that varies from person to person. This is actually a useful thing to know, because it means that supporting your broader gut health through fiber intake, fermented foods, and limiting excessive processed food is not a separate wellness tip disconnected from your circulation goals. It may directly influence how much benefit you get from a food like pomegranate in the first place. I want to also mention exercise specifically because I do not want this video to leave you with the impression that a fruit alone is the whole strategy. Walking is, frankly, one of the most well-supported interventions for leg circulation that exists in the medical literature, arguably with a stronger evidence base than any single food, including pomegranate. When you walk, the repeated contraction of your calf muscles acts almost like a secondary pump, helping push blood back up through the veins in your legs toward your heart, working alongside your natural vascular pumping. For people managing early circulation concerns, doctors often recommend a pattern of walking to the point of mild discomfort, resting briefly, and then continuing, which over weeks can actually help the body develop new small blood vessel pathways around areas of restricted flow. Pairing consistent walking with a diet that supports your vascular system, including foods like pomegranate that have real clinical backing, gives you a genuinely evidence-based combination rather than relying on any single piece in isolation. Now, I want to step back from the pomegranate specifically and speak to you about the bigger picture because I think it matters just as much as any single food. Leg circulation problems after 60 are rarely caused by one single factor, and they are rarely solved by one single food, no matter how good the research on that food happens to be. Pomegranate's role, based on the actual clinical evidence, is as a meaningful support for the underlying vascular and inflammatory processes that decline with age, working alongside things that matter just as much, staying physically active in ways that are appropriate for your body, particularly walking, which directly stimulates blood flow to the legs, managing blood pressure and blood sugar, not smoking, and getting enough quality sleep, since sleep itself plays a role in vascular repair processes. If you are dealing with leg heaviness, cramping, cold feet, or pain when walking that comes and goes, particularly if that pain eases with rest and returns with activity, I want to encourage you to bring that up with your doctor, even if it feels minor. That specific pattern can be an early sign of peripheral artery disease, and catching it early gives you far more options than waiting. Adding pomegranate to your diet is something you can do starting today, and the research suggests it is a reasonable, low-risk addition for most healthy older adults. But it works best as one part of a broader approach to your vascular health, not as a substitute for medical evaluation if something feels genuinely wrong. I know there is a temptation online, especially in health content aimed at people our age, to promise a single fruit or a single trick that will reverse years of change in your body overnight. I am not going to tell you that because it would not be honest, and I would rather earn your trust with accurate information than lose it with an exaggerated promise. What I can tell you, based on real randomized controlled trials published in respected peer-reviewed journals, conducted specifically in adults in their 50s, 60s, and 70s, is that pomegranate has a genuine, measurable relationship with the biological systems that determine how well blood reaches your legs and feet as you age. That is not nothing. That is meaningful, well-documented support for a part of your health that too often gets ignored until it becomes a serious problem. If today's video gave you something useful, I would genuinely appreciate it if you subscribed to this channel and turned on notifications, because I put out new videos every week specifically for people who want real evidence behind the health advice they are following, not just confident-sounding claims, and I want to hear from you. In the comments, tell me your age, tell me whether you already eat pomegranate or if this is new information for you, and tell me what other topics related to circulation, joint health, or healthy aging you would like me to research next. I read every comment, and it genuinely shapes what I dig into for future videos. Take care of your legs. Take care of the blood vessels that quietly keep you moving through every single day, whether you think about them or not. And remember that consistent, well-researched habits, sustained over weeks and months, are almost always more powerful than any single miracle claim you will see online. I will see you in the next video.